Hey everybody, it's Karen Anderson here with Aortic Hope, and this is another live event for 2023, and I'm so excited to have everybody here. But before I announce our guest with us tonight, I'm going to ask you to please click like and please click the bell, the little subscribe button, so that you're notified every time we go live. We go live for these events, we go live for our Monday at 3 p.m. Eastern Week in Review. We just go live because we want to. We have survivors sharing their stories. It's a lot of stuff you don't want to miss out. So please click that button, leave us a comment, ask a question. We will be addressing all of your questions this evening. But I want to bring to your attention who is our guest tonight. It's always a very popular event when we have Dr. Kristin Watson here with us. Thank you. I'm going to let you take a minute to introduce yourself. I know that you're futzing around, but before we go, I may have a moment of computer is being obnoxious tonight and could end up freezing in what would be a hideous face, but that's fine. Make fun of it. I will hop right back on from my phone, just forewarning you. I'm not leaving you for too long. But go ahead. Let everybody know a little bit of information about you.
Yeah, you got it. And Josh, since my computer's not letting me share, I'm going to pop in the chat box the slides for you on Google Drive, if that will work. So my name is Kristin Watson. I am a cardiology pharmacist with a practice at our Baltimore VA. So I have the privilege of taking care of veterans on a weekly basis, multiple times per week, which is a true honor of mine. And I also am a faculty member at the University of Maryland School of Pharmacy, which is also located in Baltimore, Maryland. As you can maybe guess behind me, in my free time, I love crafting in addition to other things, but I am in my craft room / office right now. So this is my kids' artwork behind me, not mine. So I'm so excited to be here with you. These are always such wonderful sessions, and I really value you asking questions because this is for you, not for me. So whatever I can do to answer questions for you. And as Karen knows, if I don't know the answer, I will be sure to tell you that I will look it up, find that out for you, and we can always circle back if need to after the session.
And what I love about this session, as we wait until we're able to get these slides up, is this is, of course, and we know this should be obvious, not meant to encourage anybody to stop their medication suddenly or whatever, to change their dosing. This is really a great opportunity to learn a lot about the medications you're taking, maybe some of the side effects you're feeling, and realize that there is hope, that there are other options, and you just need to have that conversation with your personal physician. So you're probably going to learn a lot tonight, and then you can write those questions, ask, make that phone call to your doctor, and you would be very surprised if changes aren't made. But the doctors don't know what to change if you're not going to share with them how you're feeling. So if anything, this should be maybe validating for the medications you're taking, helping you understand what it does to your body, and validating any side effects you're feeling. So that's what I love. I love learning something new every time we go through this.
Awesome. And I love learning for you guys as well. So yeah, and I cannot echo that sentiment enough. As a provider, if my patients don't tell me how they're feeling, concerns with medications that they have, or is something a side effect or not, then it's not going to be something that I can address for them. And the last thing we want is you in the dark, if a medication is not tolerable, or how we can better optimize things for you as well. And I know a big challenge that hopefully anybody participating tonight is not facing is drug shortages, which is being a real kick in the pants recently for a multitude of reasons. If you are experiencing drug shortages, you can contact your prescriber's office. I also encourage you to speak with a pharmacist at your site, and sometimes you just have to keep calling around. But people might be able to provide you, if there is a medication that you are on, even if it's not related to what we're talking about. None of these medications that I'm aware of are in shortage, but there's a lot of stuff in shortage. And so your local pharmacist can be really of great help. And I've just seen so much great communication, because I know we struggle with that. We're driving 20 minutes to get a medication for one of my kids, which is not the end of the world. I live in a more urban area, so unlike some folks who might be in a rural area. So please do not hesitate to ask for advice from providers, your pharmacists, because there are a lot of people who can help assist you with those challenges. The other thing I just wanted, before we kind of delve in, is many of the medications we're going to cover today are generic. So do have a low, hopefully have a pretty low copay for you. But if a cost of a medication ever becomes prohibitive for you, please talk to your prescriber, because there are often times that there is an alternative that is cheaper for you in that medication class, and that might be able to help drive down the cost. Even $8 per prescription per copay per month, that adds up real quick if you're on a lot of medications. So please don't hesitate to speak up, because fortunately, because many of these medications have been on the market for so long, there's oftentimes something a little bit more affordable. So please, again, I think that can be something we're embarrassed to ask about, right? Especially if it comes from cost, makes us vulnerable. But again, please don't hesitate to ask. That's our job, to help navigate that for you as your provider, so we can make sure that, I know cost is, it's like food, eggs, right? We all know the whole egg debacle, right? What are we going to pay for at this time? We're going to go ahead. I'm going to go through some different classes of medications that we use, that are used in folks with aortic disease. And then we'll kind of go through some tips for medication adherence as we go through, talk about vaccines briefly, as well as smoking cessation, because smoking cessation is so important for a multitude of reasons in our life, but especially people with anything related to the heart and the blood vessels. And as my patients know this about me, I've never been a smoker, but I have been in practice for almost 20 years. And the hardest thing for any of my patients to ever quit is tobacco cessation. So it's our job to work with you and support you on this. There's no judgment here. So if you have any questions about that, please don't hesitate to ask, because I think that is probably one of the most challenging things I've ever seen patients have to endure in terms of their health, because of the addictive nature of it. All right. So if anybody has anything, if there's questions, don't hesitate to ask them, and they'll be read out loud for me. So let's go ahead and pop in to our first medication class. This is so wonderful when someone is directing this for you. Makes your life so much easier. So this medication class we're going to talk about are our angiotensin converting enzyme inhibitors, or known as ACE inhibitors. So there's a list of medications that are listed here for you. I don't imagine that anyone is on a brand name of one of these medications at this point, unless it's maybe one of a combination product with another drug. So this medication class is identified with that PRIL at the end of the medication name. And so this medication class is excellent at controlling blood pressure for individuals. We also know, in addition to its benefits in lowering blood pressure, that for people who have conditions such as diabetes or chronic kidney disease, it helps protect the kidneys over time specifically, in addition to its other awesome benefits with blood pressure lowering, to help delay people needing dialysis in the future. So there's so many known benefits of this medication class, and some of the others that we'll go to, that when your provider is making decisions on medications, one of the great things about cardiology is that for most of our conditions, we have a wealth of data from research and patients who have been graciously involved in clinical trials, so that they can really help determine the most safe and effective medication. When we think about medications, we're a 2-pharmacist family in this house. And I know even when I get the drug list, I've just started on something recently, and all the side effects were there listed in that handout. I was so happy that my provider took 2 minutes before I left the office, be like, here's the 3 side effects I want you to look out for, right? Because if I would know where to kind of look out for what are going to be the most common or not. But you get that handout from your pharmacy store, you look up a drug on the internet, and it's going to have every side effect that a person who may have taken this medication in a clinical trial may have had. So with many of these medications we're going to talk about, there's only a couple big side effects we think about with them. So one, with this medication class, it can cause a dry cough. As I tell people time and time again, and it has rung true quite often, it causes a dry cough, which usually is not always bothersome to the person who was coughing, but it's bothersome to the person who you live with or the people that you live with. I kind of equate it to like snoring, right? Say my husband snores. I'm not saying he does, but if he snores, I would be the one, being impacted by it. So that dry cough can occur with this medication, and it can be hacking. And the good thing is when you stop treatment, that side effect does resolve. And this medication class has a cousin, so they can easily switch that out for you. For all of the medications we're going to talk about today, dizziness and lightheadedness is always a potential because these are medications that are either lowering blood pressure or lowering our heart rate. And one question we always will ask our patients when they come in and they say they have dizziness or lightheadedness, it's for this medication or any medication, is what brings on that dizziness or lightheadedness. So if you are getting dizzy or lightheaded, take some time to even jot down what's causing it. Is it when you're going from sitting to standing? If it's when you're turning your head side to side or lying down, that's going to be more so something with the ear, nose, and throat. But anything sitting to standing or changing positions, then we're going to have to start thinking about, is it a medication that you're taking that has an impact on blood pressure, heart rate, etc. So just be mindful of that, because I know when I'll ask that question for people, what causes the dizziness? I can't remember what I ate for breakfast, usually the day before. So to keep that together, to remember that in a visit can be tough. So anytime you think you have a side effect, keep a log of that and have that your specifics written down for when you talk to your prescriber. So again, a dry cough with this medication class. And then there is the risk of angioedema, which you'll hear. I always like to give the medical term because sometimes people will spout out a medical term and you're like, what are they saying, right? But what that really means is there can be lip, tongue, or throat swelling that can occur with this medication. And when this does, it's rare, but it is serious, and you would want to seek medical attention. Listen, anytime, I don't care what medication you're taking, if your lip or your tongue starts swelling up, you need to seek emergent medical attention. Somebody taking you or you calling 911, because heaven forbid because if things close down too much, it could impact your ability to breathe. And with several of our medications, and I won't go through this for every medication class, but that requires this, you're going to see that a lot of our medication classes require frequent blood work, and that can be just every month to start, and then periodically 2 to 4 times per year, because a lot of these medications can have an impact on our kidneys as well as our potassium levels. And we know that maintaining a certain window of a potassium level is going to be best for your heart to function correctly. So in summary, with our ACE inhibitors, so if you take anything that ends with a pril, it can cause a dry cough. And if that's bothersome, report to your provider. It can occur at any time during the course of therapy. And the same thing, if you would get that lip, tongue, throat swelling, you would never try this medication class again, but you want to seek medical attention immediately so that you can be treated quickly for this. Okay, next slide. So this is the cousin to our ACE inhibitor medications that we just spoke about in the last slide. And this is our angiotensin II receptor blockers. So these medications you'll see end with ARTAN, and there's a lot of different ones there. Losartan is a common one that is going to be used in this in the aortic community, and that's because it's not that it's most likely not better than the other agents in this class. It's just the one that has been most studied. And so providers are going to say, you know what, this one has the most evidence, and they might just feel most comfortable with using that agent. Side effects with this medication, it does not cause a cough. So if the cough happens with the ACE inhibitor, these work very similarly. They get switched to this medication. Now, you will see in any packet handouts for this medication that it can also cause that lip, tongue, throat swelling. That is incredibly rare if it ever occurs with this medication class. So it will be used in certain individuals who have that side effect with the other medication class. And so one of these medications, it is very infrequent, if ever, that they are used together. This one and the prior one. One of these is typically used, we consider it a first-line medication for people who have high blood pressure, and especially anyone who has any cardiac, aortic conditions. It's usually one of our first line agents, unless there's a reason we can't use it for an individual, because it just has so many wonderful benefits. We know it lowers blood pressure, but that we also know by lowering that blood pressure, we are reducing the risk of other things occurring, such as a heart attack, a stroke, and protecting the kidneys as well. So if we want to go to our next slide. And I'm sure many of you who are on here today are on a beta blocker, or there's another medication class that lowers heart rate. And so the first medications we talked about are two of our agents to lower blood pressure, but we also know that for many people with aortic disease, that keeping the blood pressure well controlled is really helpful. So there's a whole host, there's a very extensive list of medications in this class, but I listed the ones that are most commonly used here for you. And which agent to use, a lot of it just really will come from which medication you were trained to use by whichever person trained you in your discipline, what's going to be a cheaper medication. All three of these medication classes, and really, for the most part, pretty much everything we talked about, the really great thing is they have been on the market for so long that we have so much, we understand how to dose them. We know so much about side effects and how to manage side effects with these therapies, which is really great. So in terms of side effects with this medication, in the beginning, sometimes when people are started on this medication, it can really make them they might feel sluggish. Somebody might not. Like I could start on it and feel okay. Karen can start on this medication class and feel really tired. And the cool thing is, and there's probably differences within each of these medication class. If within this beta blocker class, if I say start on carvedilol and I'm like, oh, I'm so drained with this and we can't figure out anything else, it can work just to switch to another medication class because you may not have that same effect from another one in this class. So unlike we talked about with that lip, tongue, throat swelling with medications like lisinopril, we would never try another medication in that class again for you. But if you feel fatigued or with this medication class, we can try another agent to see if you do better. And there's no great magic wand that I can wave over somebody and say, which one's going to be the best for you and which one we're going to tolerate. So sometimes it's trial and error, which I can appreciate can be very frustrating, to do. But the good news is that when we know that they're needed, if it's not tolerated because of that feeling fatigue, we can try another class. Beta blockers are also associated with sexual dysfunction. Erectile dysfunction can occur with it. And you will see that listed, but I think the important thing to remember is the disease stage for which this medication treats can also cause erectile dysfunction. So when I'm talking to my patients, if they're aware of that, I'll say, I don't have a good alternative, especially if I know medication is incredibly beneficial. I talk about why it's important, and then I talk about what are my options for treating how we can best treat erectile dysfunction with that person. because we can't always pinpoint why the side effect is, why erectile dysfunction may be occurring, but we have really good medications that we can use to treat that. So again, I think that is one, I always tell my pharmacy students there's some quote unquote dirty topics people don't want to talk about with the providers, nor do providers want to talk about. That's pooping, urinary incontinence, sexual dysfunction, and dying. So please have those conversations with your providers. You'll probably be really surprised. And I always, that these are things we talk about so much with our patients because we know they really impact quality of life. And then for those who might be on this medication class and have diabetes, we know that some side effects, if blood sugar got really low, can be impacted with this. So especially, this is going to be mostly, we're going to think about with people who are on insulin therapy. So if you're on this medication class and you're insulin, the person who manages your diabetes is going to be able to give you a good plan for monitoring. And if you're on insulin, you're checking your sugar. So that's a really helpful thing as well. Now, in those who have, if they have underlying lung disease, such as COPD, and heart failure, we are always going to monitor for if breathing gets worse. Breathing can get worse for a multitude of reasons, but shortly after initiation, if you have initiation or starting this medication or the dosage changed, if any of these side effects listed get worse, we want you to communicate with your provider immediately. Again, it might not be this medication, but we always got to do our due diligence in checking through so that we can help treat those other conditions as well. And even if you just like Karen, I'm so glad she brought this up right from the beginning. If any of these side effects occur, you should not stop your medications on your own. You need to talk with your prescriber or provider before doing so, because especially blood pressure, heart rate control is so fundamental in people who have aortic disease. And so sometimes there's different ways medications might be able to be stopped. And sometimes there might be multiple reasons for a side effect occurring, and they have to work that out to sort that out for you. Next slide, please. Another class of medications, with such a long title here with this medication class, but these guys lower heart rate and blood pressure. So the two agents in this class are diltiazem and verapamil, and there's a multitude of different products. Some are capsules, some are once a day, twice a day. So it really comes down to probably what your prescriber is most used to prescribing, because when there are so many different products for a specific drug, we usually commit one to memory and stick with that because it helps us decrease our chances for error. So these can lower heart rate and blood pressure. You'll see here for people with certain types of heart failure, we don't use this medication class because it can make symptoms worse. And there are drug interactions with this medication class, including our statins, which are atorvastatin or Crestor, different medicines for cholesterol. And that is an important time for me to remind you, it's so important to make sure all your medications are being filled at the same pharmacy whenever possible. Because even like for Paxlovid, for instance, for treatment of COVID-19, that medication has so many drug interactions. Like we have documents that we go through, different checks to go through, and decision making we need to make when these interactions appear. So your best practice is to always have your medications filled at the same pharmacy, because the pharmacy systems are going to have checks. There's great system checks within the computer, and then your pharmacist is going to be able to figure out if it's meaningful or not. And then they can talk to your provider about what is another best option for you. So please fill all at the same pharmacy whenever possible. And like I said, most of our medication classes, there's like 3 big side effects that we think of. Now, this is outside of things like chemotherapy and for more rare conditions. But when we're thinking of our chronic disease state medications, such as things for heart rate and blood pressure, we usually have a small group of things we worry about. So constipation, as I talked about, one of I tell my students one of this quote unquote dirty topics is pooping. So constipation can occur with this medication class. So most prescribers, once they start on this medication class, if you're not on it already and would be in the future, they're going to try to talk to you about some strategies to prevent constipation from occurring with this medication class. So many people suffer with constipation and are miserable because they don't talk about it. Just like we talked about with erectile dysfunction, please talk to your provider about constipation, because letting it go untreated is just going to make you miserable, and there can be harm with that. Your your pharmacist can also be really helpful in helping you come up with helping you manage constipation in that moment. If you need to get in touch with someone quickly, pop into your pharmacy, and there's a host of options of products you can get over the counter. And then dental care, we should be getting routine dental care. I know seems to be a luxury that if you have dental insurance, not something that everybody will have, but we know that dental care is such an important part of overall health. And in cardiac, there's an association between dental health and heart health. So there can get overgrowth of the gum around the teeth with this medication class, and your dentist is going to be the one to best identify that for you. So that comes long-term with therapy, and the dentist is all over that. Not me figuring out if somebody's got this going on with their gums, and probably not many other physicians who aren't a dentist as well. So go ahead, next class. And we have two kind of groups of calcium channel blockers. So the ones that I just talked about are ones that lower blood pressure and heart rate. And that the last two that I talked about, that diltiazem and verapamil, they can be, if someone has what's called atrial fibrillation, which is an irregular heart rate, that can cause your heart rate to get really fast. Those medication classes are often used in people with that. They also have that going on. This medication class is really for people who do not have more general treatment of high blood pressure. This is my favorite one of this medication classes is my personal favorite, because we don't have to do lab monitoring for people who are on it. So the medication classes are here. They end in pines. Really, we say penes with it. But amlodipine is probably the most common medication of those listed here that is used. It's a very good medication for lowering blood pressure. And unlike our other medications that are focused on lowering blood pressure, we don't have to have routine blood work checked with. There's no blood work with this. The most common side effect that people are going to experience is they can get swelling in the ankles. And so, again, I just put the medical terms here. I don't expect you to know them, but I know that sometimes we slip into using medical terms in our encounters with patients. So just so you know what someone might say. And so the great thing is, if you would get swelling in the ankles with this medication, and it's due to this medication, nothing is wrong with you. It's just really annoying from a cosmetic perspective for people. And so if it is bothersome for you, there are different things that they can do. Try lowering the dose of the medication or switching you to an alternative agent. The swelling that comes with this medication is not something that giving you a fluid pill medication to get rid of extra fluid would help. But please report that. Again, sometimes people are like, well, what is going on with my ankles? And we're like, oh, the dose of that medication just went up to a higher dose. And we lower the dose and things get better much quickly for people. Okay, next slide. So clonidine is not commonly used it's not like our go-to, hey, this person has aortic disease or this person has high blood pressure, and we're going to reach for this medication to use. However, there are going to be select people, especially when blood pressure can be challenging to control, many Americans need to be on multiple medications to lower their blood pressure. And my concern is not the number of medications that we have you on. It's how much do we have to give? Adding on let me rephrase that. I don't get concerned when I see someone is on multiple medications for their blood pressure, as long as they're all working and they're safe and the patient's tolerating it. It's like, what do I need to get you on to get your blood pressure under control? And so this medication class is really effective, but because of its side effect profile, it's not going to be the most commonly used. The nice thing is it's available by a tablet form, and there is a patch available that people may use if they have difficult to control blood pressure. And again, it's not good, most likely, it's not something that you are doing. It's what your body is doing. None of our bodies read the textbooks, right? So it's just something unique about you, and you may need extra blood pressure lowering medications. We definitely do not want people stopping this medication suddenly. When you stop this medication, blood pressure goes up back to where it was and even higher very quickly. You can see there's a host of different side effects listed here for you. This medication class, the oral or the patch, they do a lot of different things in this one system within our body. So it's all about, like, I always tell people it's like drying things out. So your eyes can get dry and itchy. You can get a cotton ball mouth, get constipation from that as well. And then a patch, anything topical, can cause irritation or redness. Just one quick thing about dry mouth, you may see that different medications can cause dry mouth. There's a lot of different things that can cause dry mouth as well. As we age, these different glands in our mouth, this joys of aging is so much fun. And they don't produce as much saliva. Eating a lot of hard sugary candies cannot produce saliva. But there are a lot of great over-the-counter remedies if you would get dry mouth, medication related or not. There's a lot of good things that are out there, and any of your provider can give you tips as well. So again, just, before we talk about the next medication class, if you have symptoms that are bothering you, things that are bothering you, I always say keep a running log. If you're tech savvy, put it in your note. If you're like me, I carry around a notebook, and when I know especially in the week coming up to any doctor visits, any things that I want to ask, I start writing them down, and doing the same thing when I go to my visits with my husband or one of my children, that I have a list of notes written down. Because then what happens? You get back in the car, get on the bus, get in the cab, and you're like, oh, I forgot to ask about that. So putting those things down. And you may say to yourself, well, this doctor's not going to know about constipation because they're this specialist. We all know how to treat constipation, but it might be a side effect of medication. So please don't hesitate to keep that with you so you can have all of your questions addressed. And then you can take notes as well, and take notes as you're going along. So then when you leave the visit, you can refer back to that later. All right, can we push to the next slide, please? Thank you. So we have several, the next thing we're going to talk about are our thiazides. There's a lot of different medications in this class. The agents are listed here for you. They are really good medications for lowering blood pressure. And these are one of our earlier types of medications that we'll use for people who have high blood pressure because they're very effective and the side effect profile is fairly low. The biggest thing for individuals with this that I want to point out is we really should all be wearing sunscreen on the regular, because we all know what's happened in that ozone layer. But sunscreen is so important for us, but even more so with this medication, because you're going to be more likely to burn. So when the pharmacist slaps on the sticker on your bottle that has a little the sunshine on it or something else about sunscreen, please, and there's lots of other medications that can do that as well, please do not disregard that, because a nasty sunburn is no good for anybody. And then if someone has gout, as my patients and I say, we would not wish any gout on anyone, we don't think, in the world, because it is pretty terrible from a pain perspective for individuals. So if you have gout and you would pick up this medication thing and you'll see gout listed as a side effect, having gout doesn't mean you can't take this medication class. We just need to make some good decisions about dosing and things with you as well from there. So just wanted to point that out, because if I told any patient that I know that has gout, any of my patients who have gout, and they saw that on the list, they'd be like, And if I was in that place too, I would not want to take that medication as well, knowing how painful that can be for individuals. Okay, for our next class. So this next class of medication I have listed here for you, it's used for a lot of different reasons. People with heart failure may be on this medication. And this is an excellent medication class for people whose blood pressure is very hard to control. If you hear loud bumping, I have 3 sons and a puppy. So, and they're on the floor above me. It just sounded like, I don't know what was above me. So there's 2 medications in this class, and they're listed here for you. They have very great benefits in people whose blood pressure is tough to control on other medications. Your provider may prescribe one of these, and it works incredibly at lowering blood pressure. And then we're not talking about heart failure here, but if sometimes we have patients who join our calls who have heart failure as well, and one of these agents will be used. The big thing I want you to remember with this medication class, and anytime you're starting a new medication that's anything related to your heart, I always want you to ask about, if you use salts, I say stay away from the salt substitutes that look like table salt. So the reason for that is they are high in potassium. And a lot of these medications that we covered today can cause your potassium levels to increase. And so those salt substitutes that look like table salt, they can make the potassium levels go too high and can be dangerous. So if you are using any foods additives, please be sure to talk to your provider about that so that they are aware, because sometimes we're left scratching our head when we see some lab changes, and then we figure out that it is dietary in nature from things like this. And then with this medication, if there is anyone taking spironolactone, it can cause breast tenderness, breast swelling. It's only been reported in males, and I have had many of male patients who have not brought this up. We figure it out when we're, maybe we know that person really well and we see a change in body shape, or they're tender when we listen to their heart, and they don't want to bring it up because it's embarrassing to them. If you start to see breast tissue growth as a male, or tenderness, please bring that up to your provider. That is most likely, if you're on this medication, most likely due to that, and switching you to the other agent listed here, the eplerenone, can help alleviate that side effect very quickly. And so, as I always tell my patients, I don't only call in the vampires, because for our phlebotomist, the blood draw lab, when I really need to. And I know sometimes people may feel like, oh, they're checking my blood again. But as you probably saw throughout the presentation, many of our medications can impact kidney function and impact potassium. So, and every time we're making changes with that medication, with medications that can do that, we want to make sure that we are taking care of you. Safety is always first, right? We always have to keep in mind, how do we keep you safe? So that's why they are frequently calling. We're going to frequently get blood checks on individuals. And so you can talk to me if you can shoot me questions how to deal with getting blood drawn if it's uncomfortable for you. I've learned many of tricks over my own life with that. So if we can go to the next slide. And so, as I always say, patients, I don't think need any education about their water pills. So these are diuretics that if people have extra fluid on their body, not necessarily due to their aortic disease, but they might have other cardiac conditions that require to be on a water pill. I always just to like briefly cover this because there's a few different things I want to make sure you're aware of. If you are on these medications, you want to check your weight at the same time every day so that helps figure out if you're having quick weight changes, weight that's going up quickly overnight or over a few days. That's going to be due to fluid as opposed to, I was eating a lot of Oreos the past couple of days, right? And then these medications, most of them, when you take it, the effect lasts for about 6 hours. So we'll have people who are like, I just can't even go out of the house because of this. And we'll say, you know what? What's the early part of your day look like? Get your errands done. If you have things to do in the morning, get that done, get home, then come home, right? And take your dose because it's going to last 6, maybe 8 hours. Again, you want to work with, some people need it more than once a day, but you can talk with your provider. You might be able to wake up in the morning and get some stuff done so you're not stuck in the house all day with this medication. If this medication is making you feel like all you're doing is running to the bathroom each day. And then can you click the next slide? So we'll skip this one today because its use has gone down and down over time, and I can come back to it if there's any questions about it. Karen, before I go over a couple other tips, do you have any questions, things you want to make sure I tackle right now?
Yeah. Got them all here. I've been writing them down. So a couple quick questions, and you may have touched upon it, but I think that this is a really important one to bring up with the community. I think a lot of us take for granted that these medications do not work like a Tylenol. They don't take effect after 20 minutes. And I don't know of any quick fix blood pressure medications because some people will see that their blood pressure is really high and they think, oh gosh, I forgot my pill. Let me take it. It should come down really quickly. So maybe if you can explain how these medications work and why we're told to take them around the same time every day, because I think that's very interesting.
Yep. And so a couple of things before we even talk about taking them, so the practice, it's really shifted from what your blood pressure is in the office to what your blood pressure is at home. So if you have high blood pressure and you don't have a blood pressure machine already, it's really important for you to have one at your home and talk to your provider so that they can recommend their specific medication, the blood pressure cuffs that are validated, and making sure you have the right size. If you have the internet, the American Heart Association, we can always put that link up, Karen, I can give you to put up for folks. They have really great resources on there telling you which home blood pressure cuffs are validated. So the ones we know are going to be work and accurate. And how do you figure out the right blood pressure cuff size based on how your arm measures? So we want to make sure that people are sitting at rest in quiet for 5 minutes, chair with their back supported and feet flat on the floor. I know we have animals, other humans in our houses, so to be quiet for 5 minutes is tough, but take that luxury. And that is really important. And so then we want to take our blood pressure, because if we and we want to make sure we haven't had coffee, cigarettes, all those things within 30 minutes. But if we're not checking our blood pressure accurately at home, that can then cause medication doses to be adjusted when they don't need to be, or things left as they should be. And please bring those records to your office visit when you're measuring your blood pressure at home. And you can do that even just, if your visits are 3 months apart and you're fairly well controlled, start checking your blood pressure just the week before your visit and taking that login. Because again, trying to remember all this stuff in your head when you go to your visit is easier said than done. And so most of our when we are prescribing medications, we'll say, okay, take it once a day, every 12 hours, every 8 hours. And how frequent a medication is given is all the stuff that I really geek out on. It's, as a pharmacist, is like, how long is the drug effective in your body? How long is that effect going to last? And so it's important for us to take our medications consistently around the same time every day. So really getting into a good habit for when to take your medications. Like, I know I start the coffee pot, then I go take my medications, then I go back and pour my coffee. So that is a habit that I have formed for myself in addition to using a pill box. So getting into good habits is really important. Another thing that is a great question you asked that we see happen is patients will see sometimes they'll say, oh, take one tablet twice a day. Well, for me, I know why, because what I'm trained in, I know why it's that way. But we have so many people, and I understand where they're coming from when they'll say this, well, if I can take one twice a day, why can't I just take two at once? Right? And what we'll see, what will happen is blood pressures drop way too low. And then 12, 14 hours later, blood pressures are increasing after those doses are worn off. So, and sometimes it's trial and error to try to figure out your good routine. Listen, I can't, there's no way I can take a 3 times a day medication. I've tried it. It can't work. I cannot, the way my work schedule is, it is impossible for me to do. So I want you to be honest with your providers. We always say to our patients, there's a certain medication we like many of the patients that we see to be on, that's twice a day. Is this going to work for you? And then we go over that, why we want it. And if they're like, no, can't do it. Well, then, okay, because I need you to be on, if once a day works for you, that is the best option for you. Because if you can't take that second dose, the drug's not doing anything for you. So I am the first to tell my patients I can't take a 3-time medication a day. I guess if it's like, if I have to at some point, but I will never choose a 3 times a day medication for myself or my patients unless I really need to, because we know how complicated that can be. And there's a lot of it, your providers will work with you, come up with tips. The best tips I often learn on how to good habits for taking medications and tips that is like from my patients. So your providers are going to learn things as well, because they hear so many great things they've learned and antics stories that they've heard from patients, which have really worked well for others that they can share with you.
Well, it's interesting that you bring that up, because today's topic Tuesday post, I mean, in preparation for this, was all about 8 different tips, I think, on ways to remember to take your medications, from obviously like falling into a routine. You brush your teeth in the morning, your pills are right there. And then of course they're right there at night. Or there's apps now that can remind you. There's alarms, obviously, on your phone. I have a friend in the community whose mother is so wonderful, and she calls her twice a day. Remember to take your medication. So, and that's just caregivers feeling good about getting involved. But it is interesting that some of these meds, they don't work for like 2 hours, or sometimes they don't even really get cranky until 4 hours. So it is really important that to take them around the same time every day, or you're not going to have accurate readings. It's not going to work correctly for you.
Yeah, and most of these medications will last you that they're going to start wearing off right when it's time to take that next dose of the medication. Yep, go for it. What's your next question?
Okay, so my next one. Okay, so everybody says no to Advil in this community, and we were just discussing this with somebody earlier. And obviously, if your doctor says no Advil, no Advil. And some people's doctors will say, look, if you're in a lot of pain and Tylenol's not working and Advil isn't going to kill you, but that's between you and your physician. Why is it that Advil is not a preferred medication over Tylenol?
Yes. So it's that whole medication class that Advil's in, Advil, Motrin, Aleve. So there's a lot of reasons for that. And there is, and often people have multiple medical conditions for which that medication class is not ideal. One, it can, even just a dose, 2 doses can increase the risk of heart attack or stroke in somebody who's at risk for that. Folks who have heart failure, it can worsen heart failure. We also know that it can increase the risk of bleeding. And so, and it's even small doses for a short period of time can be trouble, right? But I also, so the important thing is, if your prescriber says to you, provider says to you, this is not a medication you should take, then you want to find out from them, what can I take? And the important thing is that we kind of group it into 3 different types of pain There's 3 different types of pain. And so Advil and acetaminophen Tylenol are not going to work for certain types of pain. So one of the most important things for pain is that one of your providers identifies for you what is the actual type of pain you're having so that they can give you a pain treatment for that. There's a lot of good topical products that are over the counter, such as Icy Hot, that my mom and I love because it's available in a roller form now, so we don't have to dig our hands in and put it on our joints for that. There are different patches, lidocaine patches, that again, it really also comes down to, I think, a big problem with pain management is that we don't often, as patients in the community, we can go grab our Tylenol, right? We can get an ice pack. But at the end of the day, for chronic pain, we really need to work with a provider who's going to sort out what the cause of the pain is, and so that the treatment for your pain matches what the underlying problem is for that.
Okay. So we're into the middle of March, coming around the 3rd week of March. We're hopefully rounding the bend of the really cold weather and all the snow and the cold and flu season and all of that. We're often told no to decongestants. So we're relegated to Quercetin. And I know that now Mucinex, I think, is coming out with a product that's meant for HBP. Explain why decongestants would be a no-no for a community of people that have hypertension.
So I think there's a lot of different schools of thought on that. If you use it safe, right, it really depends upon the individual, because using it safely and depending where your blood pressure is at that point, you're only going to see small changes in blood pressure. But it really depends where you are. Baseline, if you just had a heart attack, that's good, right? There's so many factors to take into consideration. So my go-to for people is saline nasal spray. Is not going to hurt you. So you can use saline nasal spray. A humidifier is a great option. And then when in doubt, as we all did with our babies who were congested, steam up the bathroom and sit there with a good book. That can be really helpful as well. So I find those can be really helpful solutions for folks for congestion. Also, Flonase nasal spray, other types of nasal spray are available over the steroid nasal sprays or over the counter. And because now, for anybody else who's in Maryland, we go in for if you have allergies, woo, the spring kicks many of our booties. And so there's a lot of steroid nasal sprays that are available, and that's just local. So you're not getting those decongestant properties within the body, potentially increasing your blood pressure. So my rule, I don't ever recommend oral decongestants. I stick with the humidifier. Telling people humidifier, saline nasal spray, and then one of the steroid nasal inhalers. For your over-the-counter meds, if you do shop at the big box stores like Costco, Sam's Club, if you go to one of those, I also understand, I have not verified this on my own, but my coworkers and Karen, we have 2 Aldis near us. We have so many supermarkets where Karen and I live, and God bless the poor world that not everybody even has access to some supermarkets, but I won't get started there. But supposedly Aldi have really good prices on some over-the-counter medications as well that you can check into for those things. Yeah, but I would stay away from it just because for safety, better options.
And we have a few more questions, I promise, and then we'll go to the community. Supplements. Are there any supplements? Because there's a lot of people that are into natural and holistic medications and stuff. Are there any supplements that could adversely affect our condition potentially, or have an impact on the medications we're prescribed?
So I am probably as anti-supplement as you are going to get, because there is not science behind. So there'll be, oh, well, this works for X, Y, and Z. That those products do not go through anywhere near the same scientific rigor. I shouldn't say all of them. For the vast majority of them, they do not go through the same scientific rigor as medications that eventually get approved by the Food and Drug Administration. We also now there is like it's Nature's Made. One of them has a stamp from USP. Most of the other ones that heaven only knows what's in some of those products. And the FDA goes after some of the big products, and they find out there's something called honey, something that's used for erectile dysfunction that I guess was big on TikTok. And I was looking it up for one of my patients and I was like, oh my gosh, right? So there are certain ones we definitely do not want to take. People should not take vitamin E, orally take vitamin E, because that is at higher risk for a brain bleed, regardless of what your underlying condition is. So, yeah, vitamin D is fine. If you need vitamin D and a prescriber tells you vitamin D, that is fine. But I am hard pressed to recommend any others because we don't have good data, especially with the drug interactions. And if you're on things that can bleed as well, that makes me very nervous.
Okay. Grapefruit. What is it about grapefruit? I hate it, but I know that you do see this on certain medications that grapefruit impacts the potency, I guess, or just the makeup. Do we have to worry about that or any other food for that matter impacting the medications that you've gone over tonight?
Yeah. So with not when we think about grapefruit, it can increase levels of certain medications. You have to drink, it's like 4 liters or something per day. So if you like a grapefruit with breakfast, have your grapefruit, right? I tell patients, don't go on a grapefruit juice diet. One, you're going to have terrible, probably heartburn from the acid.
Yeah.
And then, none of the medications that we talked about today, sometimes you will see when it comes to like food stuff is you have to separate it. Certain medications like if you have anybody's on anything for thyroid, certain medications we have to separate from food. And please be adherent to that because that will really impact the drug being adequately taken into the body and that your body can use it correctly.
Okay. And then my final question comes down between, well, it's 2 parts. One, generic and brand. Is there really a difference? Because in my mind, I swear, I think when I started a new generic beta blocker from the brand, I started seeing my blood pressure go up. It just started creeping up. And I felt instinctively in my body, I just thought, this is not really even working. I thought they gave me a placebo. And I was told, no, it's really pretty much the same. So now, but I've actually had to increase that medication, which that's the first time in 8 years. I've never had a problem. And, it ended up being Nebivolol. And next thing you know, like, it's not working the same for me, but it just came to that conclusion. So I'm curious to know your thoughts.
Yeah, I have no problems because we have such good regulations on medications in this country. For a product should be generic. Granted, could things happen? Sure, right? Nothing's ever perfect in the world, but there are such rigorous standards that manufacturers have to go through for brand generic. The only time we will say not to go back and forth between products are just there's certain medication classes in which they're monitoring blood levels in, and that's going to be like a certain blood thinner, a certain there's a couple other like something if people had a transplant, and you just have to stick with the same product because there can be such nuanced variability, but otherwise, no. I never recommend switching soap to generic because it just doesn't lather for me, but that is another story.
And then finally, in speaking generic and brand and insurance and issues, if somebody is having an insurance issue, other than GoodRx, which works wonders. I mean, it really does. It takes 2 seconds to fill out for that card. I took a snapshot on my phone. I looked at where the medication was the least expensive. And like a drug that I've been paying hundreds of dollars now was $16.47 at Wegmans. Do you have any other recommendations on ways that people can save if they're having an issue with their insurance?
Yeah. So the $4 list, Target, Walmart, pull that up. Still use that. Sometimes that can be cheaper than copays, which is wild for me. The other thing, if you have the ability to, right, and I say this because these things are like a nightmare to get through websites. If you can figure out how to navigate your pharmacy, if you have pharmacy insurance and you are able to navigate their website and find your formulary, which will tell you your preferred medication, and if you can like keep that handy somehow, like on a file on your phone or elsewhere, that can be really helpful. These, everybody's got this story where it changes over at January 1 or something else. And, I work with my aunt on her stuff, and the time just figuring out where to click on the website it's a very tedious process. And unfortunately, not everybody has that time, or you could have a very complicated website. Your pharmacist can often also tell you they can run what are called test claims. So especially like certain medications, like we have these, if somebody's on a blood thinner, let's say, there's 4 medications that are really used. So if they need to, they can always run these claims to figure, you can always ask them, if hopefully they have enough staff to help you, because we all know they're understaffed, but I won't digress. There can be test claims that can be run too, and your pharmacist can often figure out which might be within that class. But what gets tough is when you're on a same medication class a medication for so long that your insurance changes your mind. I would definitely look at things like GoodRx. That's the one that comes to mind. I do practice within a VA, so we live in this wonderful world of coverage for medication. So I do know that my knowledge of private insurances is really limited to just family members and stuff like that. Yeah.
And the reason I bring it up is I've been on Bistolic for years, and then I switched because SilverScript said, bye-bye, we'll do Nebivolol. Humana's like, I'm not doing either. And that's who I switched to. So, and in my opinion, I'm like, that's fine. Because with GoodRx, it was less money than my copay anyway. So it all ends up working out in the end. Because the one thing I won't do is switch the drugs, because it's finally working. So that's why I just want people to know about that. And I do know Cost Plus, which I think was Mark Cuban's organization, is another potential to look into. I didn't go that route because I get nervous with 90-day mail-in supply. Like, what if it doesn't make it to me and then I'm out? That kind of stuff. I like to be able to go pick it up and then come home. But enough about me and my questions. Let's check in with Josh and let's see if we've got anybody else that has questions.
Yeah, and like you check
so
in there,
much,
I think we're going to see big shakeups. I am hopeful that we're going to start seeing big shakeups with medication prices. We just heard insulin prices are going to be going down from 2 big pharmaceutical companies, and I'm hopeful with all this friendly competition that we are seeing, that we are going to start doing a better job.
Thank you very much, Doctor. Have you ever heard of the website Cost Plus Drugs?
No, but I think Karen just mentioned that. And I'm going to trust her if she heard about it, and I'll definitely research it. Again, I'm very spoiled that we in the Veterans Affairs system with our access to medications is really it's deserved for the veterans, but it is a big privilege that I know that we don't navigate those processes. But I will definitely check it out.
I found out about Cost Plus from a cardiologist. So that's why I felt so comfortable looking into it. And I may very well go back and try it out with something that wouldn't be so horrible because the mail has been so screwed up for so long. So maybe I'll try it with like vitamin D or something that's not so critical to my needs, that if it doesn't make it on time, I can test out that. But I felt that since a doctor told me about Cost Plus, I feel like it must be okay.
And I'm going to, I just made myself a note to talk to I have many colleagues who practice within medical systems and different hospitals, to ask them about different cards and resources that I know a GoodRx is the go-to, but other ones that they might be aware of. So, and I can bring those back. Yeah.
And Amazon has been pushing into the pharmacy market. Have you had anybody that's experienced any of that yet?
Not me personally, just again because of the VA, but one of my friends asked about it and I told them no, because my understanding is that they don't have all medications and they're only going to start with a small amount of medications. The last time I read about it a few weeks ago, and my fear over the lack of drug interaction checks terrifies me, because very common medications that we use, if drug interactions do not occur, some side effects that can occur are not good. So not necessarily medications we today, but like diltiazem, verapamil that we covered, that interacts with a lot of medications. And not knowing that a person is on one of those medications and not doing the right dose adjustments is a recipe for trouble. So while I am so hopeful for more opportunities for better cost-effective medications, but I think it needs to, my personal viewpoint is that it needs to be where you can have all your prescriptions filled, because I just am terrified about what can happen with drug interactions. And maybe there's a mechanism that's going to work that I just don't know, because we are having more we're not even solidified with medical records knowing medical records across all health systems and healthcare providers. So I don't have high hopes for the insurances, but these different pharmacy practices, but I could be wrong. But that is my fear with those. If it's
I kind of see like you. I feel like if we're telling all of our community members, have your CT scans, your MRs, all of that done at the same facility for the purposes of it being consistent, then I want to go to my pharmacist. I want to become friends with my pharmacist. I like it when I get a call that says, how's that new drug been working for you? How are you feeling? Is there anything we should take note of? Or, hey, your doctor wanted to put you on this, but I don't think they remember that you told us you have an allergy. Because I can't remember everything that I feel I have an adverse reaction to. So having that one place that you keep going to consistently, that's very different, I think, than going through an Amazon. It's very different.
And I love my independent community pharmacist, 100%. So, yes, 100%.
Okay. All right. So let's get to this chat. Let's say hi to Michelle Wegman. Hi to Rob Seltzer.
I feel like we're on a radio show now.
It's a little
I
bit
always
like
wanted
that.
to be Frasier. So, okay, I'll be Frasier today.
Hello, Bo is here. That's his signature line. Bo is here. Maximilian 10 says hi.
Hello.
All right. So the one question we have so far is, what about cannabis for anxiety and pain?
So there is a lot of interest in cannabis. We're starting to see more and more research about the safety of cannabis and different products within that realm. And there's more and more evidence coming out about the safety of certain products and its impact on cardiac health. Now, that being said, there are going to be people who are going to need to take it for certain medicinal purposes. And I think that discussion, as I always say, every discussion needs to be one in which you are well informed, because you are the decision maker. So you have to be well informed, and it is going to be something so specific. People are from different states and stuff, and different states have different rules. I forget what's happening here. I think we're going to be going that it's going to be open for all. So I highly recommend, again, just start using it without direction from a medical provider. There are going to be times that there are going to be other more effective medications that may not have been tried that we know are available by prescription. There are a lot of great things such as therapy that can be options. So self-medicating is never the way I want anyone to go, because we need, as much as there's so many options we can afford to, but there are going to be people who may need it, right? There may be people who need those products, but there is so much, and I am not an expert in that. There are so many nuances in that field with different products and side effects and stuff that I would want your provider being informed in that conversation with you.
And the other point is, I can't imagine you're going to find a provider that is going to support smoking. Mm-hmm. So I would think that if they're going to support the idea of taking cannabis, they're going to support something that's more edible or oil. I don't think they're going to support actually smoking. And that's the part that we were going to get to at the final part of your presentation, because it's not going to be good for anybody in this community. It's really not good for anybody, period. But I would think that if they're going to say yes, it would probably be more edible. But I agree with you. You should be followed, and it should be monitored, regulated.
Mm-hmm.
Okay. Bo says that he's been taking the same blood pressure medicine for 11 years. And I said, same dosage and same times of day as well. And he said, yep, 10 a.m. and 11 p.m. every day, 11 years.
That's amazing. So a lot of these medications that we're going to use, the efficacy, how well they work doesn't wane over time. Now, a thing to keep in mind is if it's ever would seem with a blood pressure medication that you are like, well, it's just not working as well. Well, fun fact, we're all getting older. So the older we get, the more our blood pressure is going to start to increase. So that is amazing that you've been on the same dose, and the side effects are really well tolerated for most of our medications. So if you do see blood pressure starting to creep up after over 5-10 years, age is probably a big reason for that, unless there's other things that might be going on in your life that are or a disease state that's has not been diagnosed. But yeah, I mean, a lot of these medications, they're lifers.
Are there moments where a person can be on a medication for a certain period of time and then their body just become too adjusted to it, and so now you gotta maybe need
I was trying to think of an example as I was talking, and I know it's out there, and like nitric. So if anybody, there we go, got it. So if anybody takes something like isosorbide for chest pain, isosorbide, mononitrate, dinitrate, the body over time sometimes might need different, because the body just needs a little bit more, because it eventually can kind of develop a tolerance to it. Same thing with opioids, right? Pain, sometimes tolerance can develop to that over time, certain types of pain medications as well, but not anything that we talked about today. It would just be something else is going on, like, and sometimes it's just age, right? It's just age. You picked up a few extra pounds, and you need it.
Okay. We're going to say hi to CA. They send us
CA.
love and light.
Thank you.
Bo says, can't take Lanacane, gave me nightmares.
Lanacane?
That's what
Lidocaine. We spell it
Lanacane. I don't know.
Lidocaine.
I don't know.
I don't know.
I don't know. Rob says, Dr. Watson, thank you for sharing. When it comes to medication questions, I trust my pharmacist more than my physician.
Well, I think they do a nice job working hand in hand, right? So I think that it's kind of like the checks and balances. That's kind of how I look at it sometimes.
I think what Dr. Kristin said about not having the interoperability of medical records is a linchpin for pharmacists to have to stitch together the orders coming from disparate sources.
Oh, 100%. That can be very challenging. And it's like, oh, I prescribed this. And again, this is the beauty of that. We're very lucky at the VA, because it is an all-one system for the most part. Lanacane looks to be a first aid spray with things in it that I might not be aware of, but I imagine that that is not what the person.
Well, would you recommend, I think that at the beginning of the year, when you have to bring your new insurance card in and all that verification or any changes with your pharmacist, that's a time where I like to take a few moments and I say, let's go over the prescription list you have. I just want to go down the list and say, yes, no, no, yes, that I'm still on it or I'm not on it, or, anything, because they're going to know dosages have changed. But I find there's so much that's still in the records that, because I'll get calls, do you want this refilled? And I'll just say no, but I forget to just actually call and say, take it off the list, because they don't know what I'm still taking or not, which is what you were saying. So I think that's sometimes a good time to do a check-in and make sure everything's clean for the year and they've got exactly what you're on and only what you're currently taking.
Yeah, that's a really great point. Again, my spoiledness at the VA, if a medication's off, we discontinue it. But like if you get something filled, like where I go to Plumtree Pharmacy, plug for my community pharmacist, who's amazing. She because I have a condition and we're trying all kinds of things, and she'll be like, I think we're off this and that. You don't need me to order, because she has to order it special. And I'm like, yep, you're right. Because there's not that process with your community pharmacy, unless there's a connection with the medical system where they see those orders discontinued. So thank you for bringing that up. You bring up the best tips, Karen. So that is a challenge, and that can lead to, and that's why I always tell people, carry a medication card with you, with all of your medications, because God forbid something happens to you and you can't communicate, they're going to call your pharmacy. And if your pharmacy is not aware, what we'll get is like when things have been filled, and that can be really good clues for like, oh, they must not be taking this anymore. But the systems are not sophisticated enough, and the authority that pharmacists have, they're not able to always update the records in that manner. And so I always tell people, God forbid something happens to you, have that card in your wallet. If you got there's these fancy laminators that's how Pokemon cards, what's happening with Pokemon cards. That's the only reason I know about this. So you can get these like business card laminator things that you can even laminate your own card. And listen, I know everything's not super cheap, but it's like $7 for like 100. So even if you have to redo your cards, and then you can keep it in your wallet, so that you have that card on you along with all of your providers' numbers, right? Because like if someone knows you've had some type, you can look on a chest if somebody had some type of surgery, knowing who your surgeon was, if they have to get that information, can be really helpful. Where to get your medical records is holding on to all of, having that medication, that list somewhere is really important.
Yay.
Yay.
We did it.
Oh, I was going to
Made
say,
it.
did we lose Karen?
Oh no, I'm here.
Okay.
We did it. We made it through our questions. Yeah. Okay.
Right on.
Do you want to finish up with the tobacco cessation?
Yeah, so I just have a few things that I want to share with you for, and I'll leave the last slide up after this. So if you can go to slide 12, please. I just want to hit on a few things again for tobacco cessation. There's a really great resource through the Centers for Disease Control, which is 1-800-QUIT-NOW. And my patients have all found, various patients have told me how helpful it's been through them. You can call that number 24/7. They have resources available to get some nicotine replacement products to individuals. There's even text messaging alerts that you can sign up for them. And as one of my patients told me, he said, I swear it knew every time I was going to want to smoke a cigarette, and I would get a text message about it. Probably, I would imagine you had to answer some questions. There's different products that we can use. We know that the varenicline Chantix is the most effective in helping people smoke. But as I always tell my patients, we come up together with a plan which is going to be the best for you based on what information I'm sharing and what you want to try out. And give yourself patience if you relapse. It takes a lot of people, multiple times to quit. And so I always tell my patients, if you start smoking again, just call me and we're going to figure out what we can do to help. Right. And so we're all human here. Their best option, and which I don't think we do enough of in this country, if somebody is trying to stop smoking, the best strategy to stop, the most effective thing, the thing that's going to work best to help people stop smoking is some type of treatment. So that's going to be prescription medication or 2 different types of nicotine replacement products like the patch, and then one of the things that you can pop when you have those cravings, in addition to counseling. And we don't do enough with that counseling aspect here. So if you can get tied into those resources, ask your providers. And again, and it also, I could talk about smoking cessation forever, but like if you slip up, we'll help you get back. Your provider will help you get back again to help stopping. And please don't beat yourself up with that. But it is such an important thing to do for your right. There's so many benefits of smoking cessation, but you got to be ready for it to be ready to stop. And then the next slide just has some tips on there for remembering when to take all of your medications. A lot of things that we talked about already are listed here. If you are a person who loves to read or enjoys reading, I just read this book called Atomic Habits that I guess is on the New York bestseller list right now. It's a quick, very interesting read about habits. And that I was having some trouble, like pharmacist med adherence issues. I would always get them in, but like was struggling to get my habit back on track. And there's a lot of great things about habit in there that I think can help for healthy lifestyles and just wellness in general, including sleep, which we know is such an important part of overall health and our cardiac health as well. So if you are interested in reading, libraries are going to have that, whatever. Atomic Habits, I just felt was book's not going to be for everybody, but I just thought it was a really great thing. And it's helped me and some of my friends who just read that make some better lifestyle decisions in terms of like our exercise, our sleep. And I know for me, medication adherence and to help you out with that. So check it out. And that is it. And it was a pleasure as always. Thank you for letting me being part and coming in and enjoying being involved with your community. It truly is enjoyable, and always get vaccinated. I am a big vaccine proponent. So any vaccine that's, if you ever have questions about that, I can't answer them all, but I can answer some of them for you.
And one of the exciting things we have to remind everybody is, one, you will be attending the Rock from the Heart Symposium on April 21st as a speaker, going through all of this and more. And you are also going to be jumping into one of our support groups at the end of April, the evening support group meeting at 7 p.m., which will give a little bit more one-on-one interaction. So that's also so very exciting. And so we love having you here because there's always new people joining the community or current community members that are changing medication. And it's important to be able to get this information. And this presentation does live again under our resources section on our website. So you can always refer back to it or just watch this video, but don't forget to click like, push the subscribe button and share it and leave some comments. Sharing is caring, knowledge is power, all of those fun things, but it's true. So if you just share it on your personal page, this will be really helpful for others as well.
Right on. Some final thoughts here. Rob says that the pharma discount cards you have to register for them, and they're only good if you're on private insurance. They're not good for Medicare. So
yes, and
so yeah, I'm on Medicare. I'm on Medicare, and because they won't cover the brand or the generic, I can use that GoodRx now.
Okay, and also the help belts for medication lists. Rob says, push the help belts for holding your medication list right in there.
Yes, so our help belts, which I guess you can see them right here, and they're on our website underneath our Hope Shop. So like this is one of them. I'm trying to be, and there we go. This one's for Medical Alert, but they come in 3 different colors, yellow, black, and red, with a variety of sayings: Medical Alert, thoracic aortic aneurysm, abdominal aortic aneurysm, aortic dissection, Marfan syndrome, Loeys-Dietz syndrome, in French, in English. And what he was saying is, on the back, there is this card that fits into a slot, and this wraps around your seatbelt. So there is opportunity to put your allergies, your medications. In addition, if you go to Lawrence Hope, which is another resource on our page, and you talk with them, they have free shopping service, and they can help you put down the most key critical medications that you're on, which would be blood thinner, it would be one, or allergies to contrast, or anything of that nature. They know the acronyms because they're working with the first responders to develop that. And they're very familiar now with aortic disease. So both of those can use it whether you have aortic disease or not. Both of those give you an opportunity to have the card that you were talking about. And there's a place, I think, on your phone. There's a whole emergency section on phones nowadays where you can put your, in case of emergency, your allergies, things like that. So, but I do love the idea of getting a laminator and creating my own card to go in my wallet, or one to give to my spouse, so that if there is a problem, he can whip that right out if there's an emergency.
Yeah, that's a really good
Thanks,
idea.
Ross. Thanks for the reminder. Plug.
Yeah. Clarification on the Lanacane. They call it the magic mouthwash. He was taking it for his cancer, and that is what gave him the bad nightmares.
Yeah. So, yeah. So I wonder if some might have got, because the magic mouthwash is for something what's called mucositis from certain types of chemotherapy, and it does a terrible number inside people's mouths, and they do this swish and you can do swish and swallow. So it could have, the medication there can do that. It's not something that it definitely, because it can affect things upstairs. But yeah, that is a great medication. I'm not sure that it's common for everybody. And that the lidocaine that is in the Swish and Swallow is, while the topical is also lidocaine, the topical patch product is not going to be absorbed. So I'm not sure if you would have the same thing, but listen, if you know, to each their own, because I despise nightmares like nobody's business. And if I was worried about something giving me a nightmare, I got no judgment if you're like, I'm not taking that topical product. So thank you.
Okay. That concludes our chat.
That's wonderful. Again, thank you so much. Thank you to everyone who participated tonight. And if you have questions moving forward, you can send them to info@aortichope.org. We'll be sure to get them answered from Dr. Watson. And thank you so much for joining us again. And I look forward to seeing you in a few weeks at the symposium. It's so exciting. And if you can't, I know if you can't be there in person, you can register and join virtually, and you'll have a chance to see all of the great speakers, including Kristin Watson. So thank you again so much. Thank you to everybody. Thanks, Josh. And we will see you soon in our next live event. Take care.